Okay, hello everyone. Good morning, afternoon, and evening. Dear authors and invited guests, welcome to Technical Session 13E. My name is Amok Dhamdere and I will be moderating this session. On behalf of Global Knowledge Research Foundation and GR Scholastic, it is my great pleasure to welcome all of you to the 11th International Congress on Information and Communication Technology, ICICT 2026. The 11th version of this conference is being organized in a hybrid mode. The physical event was held in London, UK, and the virtual event is scheduled to be held on Zoom from the 25th to the 27th of February in 2026. I hope all of you will enjoy the interactive sessions we have planned further. In this particular session, we will be having 6 presentations, and each presenter will be given 12 minutes for their presentation and then 3 minutes for questions and answers. And on the completion of 10 minutes, I will be raising a gentle reminder. There is another request to all the participants that all of you please stay connected with us until the closing remarks are given. And if you have any queries or updates, you can write it to me in the chat box. And now, before we begin with our sessions, I would like to introduce our session chair for this session. So our session chair for today is Dr. Sagar Bilaji Shinde. Dr. Sagar Bilaji Shinde serves as Dean Academics and Professor at the Nutan Maharashtra Institute of Engineering and Technology in Pune. With 15 years of experience in the education field at various academic levels, he is a senior member of IEEE and has published more than 20 research papers in reputed journals and conferences. His key areas of expertise include artificial intelligence and IoT. We welcome you, sir, and I request you to give us your opening remarks.
Thank you. Thank you. First of all, I would like to congratulate to all the participants for presenting their research in the emerging technology. And no doubt, this conference is nothing but the very good platform for sharing the knowledge and whatever the research is going on. So it is nothing but the sharing of knowledge along with the all the participants, and with the help of future scope, so many participants will get the problem statement for the next research in the uh, next couple of years. So all the best to all the participants. Please start the presentation. Thank you.
Thank you so much for your kind words, sir. Without any further ado, we will now begin with our presentations. So our first presenter for today is Tien Tran Van. I apologize for any mispronunciations, but he belongs to the University of Technology, HCMUT in Vietnam, and the title of his research paper is Automatic Multi-Scale Retinex-Based Enhancement for White Light Cervical Colposcopy Images. Sir, I request you to kindly unmute yourself and start presenting.
Thank you. I'm here. Now I can share screens.
Sir, are you sharing your screen?
Oh, wait a minute.
Sorry, I couldn't hear you, sir.
Okay. Can you hear? Can you see me?
Yes, sir. Your screen is visible and you are audible as well, so you can start.
Yes, I can start. Good afternoon, everyone. I'm Tiến Trần Văn from Ho Chi Minh City University Technology. Today, I will present our work on automatic multi-scale readiness by enhancement for wildlife cervical colposcopy image. In many resource limit settings, legacy colposcopy systems are still widely used, but they often produce low contrast image with non-uniform illumination. Wearable, a fully automatic multi-scale retina framework with adaptive intensity regulation density and standard reprocessing solution to improve clinical visualization while preserving structural fidelity. The service is low pass of the uterus, and during colposcopy, clinicians focus particularly on squamous, columnar junction, and transformation zones. There are reasons where most precancer chains begin develop and epithelial texture and vascular pattern in the areas critical diagnostic cure. Therefore, any image enhancement methods must improve visible while preserve the morphological structure without distortions. Cervical cancer remains significant public health concern in Vietnam. In 2022, there are over 4,000 new cases and approximately 2,400 deaths. It's seven leading cause cancer deaths among on female and a leading cause for women that more productive year. The number highlight important effects, screening, early detection. In clinical practice, cervical cancer screening follows standard workflow. It typical beginning with cytology screening such as pap smear. If abnormal and detect, the patient refer for colposcopy, where service is examined under magnification. Species reason identified using colposcopy are then confirmed through biopsy with serve as histopathological gold standards. During colposcopy, clinical might use multi-image moduli, while imaging is primary mode used for general morphological assessment. A green filter, enhanced vascular contrast, and Lugon iodine highlight abnormal epithelial region based on glycogen content. However, while image quarterly remain foundation anti-examination, therefore providing wildlife imaging quality, especially in non-uniform illuminate and legacy system, is critical for consistent and reliable visual interpretation. To address the limitation, our study guide to four primary objectives. First, develop fully automatic image enhanced framework by multi-scale retina. Second, to compensate hardware-related issues such as low contrast and non-uniform illumination. Third, enhance diagnostical relay structure, particularly epithelial texture and vascular pattern. And finally, maintain structural fidelity by prevent noise, amplification, artificial, and artifacts. Our framework follows structural fast-type pipeline, reprocessing, multi-scale readiness, adaptive regulation, detail enhancement, and quantity elevation. We evaluate methods on 30 clinical wildlife images, including scene 1 to 3K. On image were acquired using conventional laser colposcopy system at resolution as 1920 by 960 pixels. Important, the system operates fully automatically without manual parameter churning. The first two states, we normalize inputs in my recover non-uniform illumination using multi-scale retinas. First, on RGB image are converted to the pole resistance normalized to range 0 to range 0. Next, multi-scale retina applied independent is color channel. The core ID retina decouple illuminate from reflected by subtracting Gaussian blur version of the image from input image. We use three spatial scale 30, 80, and 250 to capture structure from 5 texture to global lighting variation. Although multi-scale retina improve illumination, it may also into over-enhancement noise amplification in low-intensity region. To address this issue, we introduced side mode by softmax regulate enhancement intensity partially. In that how tech housing, the seed mode function provides smooth transition between dark and bright region, presenting halo artifacts and abrupt total change. In addition, we incorporate adaptive shadow booting factor selective enhance under exposed area without voicing in well exposed region. Finally, we apply Gaussian by unsharp marking, extract high frequency detail with a re-injected into image under guideline of the softmax. The evaluate enhancement performance, we use three complement image metrics. First, entropy measure richness of structure information in the image. Second, local contrast quantity using EME, evaluate contrast improvement in local region. Third, 10 nuclei index measure gradients by sharpness to ensure equal and enhance window exercise amplification. We combine three metrics into compound fitness score to define a weight sum. Result and discussion. Let us first attempt to present the scene one K in original wildlife image an event illumination certificate of Q epithelium tattoo within highlight regions. When we apply CLISE, contrast is increased. However, density granular noise appear in the dark, and subject structure remain spatial suppressed. In contrast, our robotic method restore brightness more uniform through adaptive shadow regulation. The sigmas by softmax ensure smooth toner transition and prevent its overexposure. In bright region, result clean epithelial tattoo without artificial artifacts. The second, this slide presents representative scene 2K, where accurate boundaries visualization is particularly important. In the original wildlife image, the lesson boundary within highlight region appear poorly defined due to suboptimal illumination. In here, when CISE apply, contrast increase. However, introduce not able tattoo, road tannins, and granular noise, which might interfere with morphological interpretation. And our robotic method produce a more coherent visualization. The lesson boundary become continuous, well-defined, while fine structure detail and enhance without aesthetic tattoo applications. And continue to the scene 3K, where density micro vascular proliferation a K diagnostic feature on the original
Excuse me, sir.
website. Yes, I'm here.
Just a reminder, you have 2 minutes of presentation time left. Thank you.
Thank you. After enhancement, vascular patterns become sharper and more continuous across the region internet. The magnifier will further illustrate improve contrast between blood vessel here and cerebral epithelium. The block plots show the distribution, entropy, local contrast, tending, grass sharpness, and the composite fitness score across sync 1 to 3 group. Entropy value remain consistent high with narrow variation, indicate effective reservation of structural information. Local contrast measured by EME exhibits compact overlapping distributions across all grades, suggesting stable enhancement behavior independent lesson sensitivity. The Tandy index remains low stable within the day. The enhancement does not rely excessive gradient amplification artificial sharpness. Overall, strong overlap across scene grade suggests algorithm operations in my property rather than pathological bias. In conclusion, we have developed fully automated image enhancement framework based on multi-scale with adaptive intensity regulate. The process, methods, effective, compensates, illumination, non-uniform, and low contrast legacy compost copy system. It enhances epithelial, texture, and vascular structure while reservation structural fidelity avoid artificial artifacts. Quantitative evaluation across Sync 1 to Sync 3 demonstrate step consistent behavior dependent rate. The broad service standard preprocessing solution that can be integrated into exciting clinical in my workflow. Thank you for your attention.
Thank you for your presentation, sir. I now ask our session chair if he has any questions for you.
Yes, I'm
Doctor,
here.
your work is really impressive. Just want to ask you about funding. Have you received any funding from the government or any agency?
I'm glad you
Hello.
asked. Yes, I'm here. I'm what relay funding from Vietnam National University, Ho Chi Minh City.
Okay, okay. Your objectives are very clear and it is clearly stated, and result and discussion was also very good, and you have explained it thoroughly. So good presentation. Thank you.
Thank you so
Thank
much
you
for
so
your
much for the
presentation,
feedback.
sir.
I'm really glad. Yes, thank you, thank you.
Yes, thank you for your presentation. We now move on to our next speaker for today. So our next speaker is Antonio Junior Alves Caido from the Southern Methodist University in the United States of America. And the title of the research paper is Dropout Robustness and Cognitive Profiling of Transformer Models via Stochastic Inference. Sir, I request you to kindly unmute yourself and start presenting.
Let me work on just share my screen. Just give me a second.
Sure, sir.
Can you see my screen now?
Yes, sir, your screen is visible and you can start presenting.
Okay. Good morning, everyone. I'm Anton Kaya from Live School of Engineering at South Methodist University. Today, I will present you our work on dropout robustness and cognitive proofing of transformer models with stochastic inference, conducted by advisor Mike Hustler. This is a symmetric evaluation of one chiral dropout across 19 transformers. Architectures, different orders, scales, and importantly, two distinct cognitive domains, memory and reasoning. Let me start with the background. Dropout training regularization was introduced by Sharif Stubble and his colleague back in 2014 as a training time regularization. It's randomly deactivated neurons run training to prevent co-adaptation of futures and to reduce overfeeding, promoting redundancy and smoother loss landscapes. Variants like drop out connect, zoom out, and drop block, followed by O were designed for training, no inference. The critical gap
Excuse me, sir.
highlighted. Yes,
Sir, your voice is a little bit low. Can you try to fix it, please? It's like you are clearly audible to us, but your voice is just a little bit low, so that's why.
let me see my microphone. Maybe the microphone is. Wait, give me a second.
Okay,
Maybe
sir.
yeah, yeah. Cool.
Inside your screen is frozen here.
One second. Let me see here. Speaker, microphone. Okay, I got it. What it is. Is the microphone better now?
Yes, sir, it's much better, but there is also a problem with your screen. It appears to be frozen.
Let me. I put it in present mode. I will do it without present mode. Let's see if it's not freezing.
Sure, sir, you can try that once again, please.
Can you see the screen now? Did they change?
Yes, sir. If you want, you can present it this way as well. It's just fine.
Oh, okay. And can you see on this without present mode in PowerPoint?
Yes, sir.
Okay, so let me continue. So, yeah. So on slide 3, like I will basically talk about the Monte Carlo stochastic inference. And let me know if you are not seeing, so I can fix myself here. So
You are now presenting the Monte Carlo dropout slide, right?
Yes.
Yeah, your screen is working just fine. No. Your screen is visible. I'm sorry to interrupt.
Okay, no, it's fine. So process has 5 different steps. Fine-tuning models with dropout active during the training, which is a standard procedure. At inference time, keep dropout in training mode rather than disable the training mode. Runtime is stochastic word passes per sample. This is more like Monte Carlo sampling. Computer run level accuracy for each of those 100 passes and report 2 metrics, means accuracy as our point of estimation of performance and standard deviation as our uncertainty proxy. These 2 metrics are orthogonal, and that distinction is central to everything that follows. Let me explain you 3 assumptions we set out on our test. The slide changed now. So the assumptions we test is we design our study around 3 widely held but unverified assumptions. First, Monte Carlo dropout improves the robustness, assumed since Gall and Gendering in 2016 work, but never systematically test across diverse transformer families. Second, larger models are more stable. Scaling laws suggest better generalization, but stochastic inference robustness is untested across our range of 4 million to 355 million parameters. Third, dropout generalize across architectures. We compare encoder-only families like Bertha, Roberta, DiBerta, and Electra against decoder-only families like GPT-2 and GPT-Neo. In total, 19 models, 95 configuration, 5 dropout settings, 100 stochastic passes per sample across both memory and reasonable tests. To evaluate this, we first need to precisely define what is robustness. And robustness definition can be viewed as a model that maintain high means of accuracy and low stutter development across different stochastic passes. We define robustness along 2 big orthogonal dimensions, and the mean of accuracy is our point of estimation of performance, average across 100 stochastic forward passes per test sample. Standard deviation is our primary robustness indicator. Lower values means stable prediction under dropout perturbation. These 2 dimensions are orthogonal. A model can be accurate but volatile, are stable but mediocre. Robust deployment require both high means of accuracy and low variance. Standard benchmark only report means of accuracy and ignore prediction. Standard stability entirely, which is critical and blind spot when you work and post test and you try to figure out what is the accuracy. Now let's describe the experimental protocol. Basically, the experimental protocol, we use 5 dropout configuration: deterministic, baseline, high attention, high feed forward, high and high out. For evaluation, we use the squad version 1 test memory to factual recall from computer passes, and we use Hellosaw test prism to common sense events continuation. Each dataset contributes 100 test samples, which is a 80-20 straight 5 split at the seed 42 per reproducibility when you reproduce 42 times. Each sample receives 100 stochastic pass, giving us 10,000 per pass per model configuration robustness measurement, both accuracy and stability, which this is in place. Let's show what we found in the first result. The first result we strike with Monte Carlo dropout often reducing performance, contrary to common assumption. 53% of the models perform better with deterministic inference than with Monte Carlo dropout. The largest degradation occur in testing specialized models, like Roberta drops from 0.735 deterministic accuracy to 0.497, which Monte Carlo baseline a loss of 23.8% points, which is a lot. And this isn't a noise. The neighbor dropout raises the standard deviation from 0 to 0.031. Confirm the effect is structural. As you can see in the figure 1, other heavily affected models include Alberta base 2, Departure version 3, and electro-based discrimination and span Departure base case. This directly contradicts the assumption that MEC dropout universally improved robustness. For over half of our models is actively degrades performance, but the degradation is not union across all tests. When we look at the memory and reasoning, dropout affect memory and reasoning tasks in the fundamental different ways. In high dropout configuration, 0.6 reduce memory task accuracy by 25.9% points, dropping from 0.7 to 0.533. In contrast, reasoning accuracy barely moves from 0.49 to 0.497, essentially unchanged. This asymmetry holds consistent across all architecture tests. While memory tests rely on a stable, localized circuit, precise factors retrieval gets scrambled when random neurons are deactivated. Reason, on the other hand, uses distribution redundant paths that survive stochastic masking. Multiple reasonable routes can be compensated when the dropout block is 1. Basically, memory is more localized and it's more circuit and it's more hardware. And when you think about the other side, it's more software and you offer you different paths. And that's one of the reasons and the whys here. If you see figure 2 and 3 on our work, illustrate this clearly. Task specialized models show severe memory degradation but stable reasonable performance. This asymmetry points to a deeper pattern, which brings us to universal memory bias. A baseline dropout 84% of models, 16 out of 19 models demonstrate a memory-based performance with a mean gap of 30% points over reasoning. Encoder-only architecture show 0.782 memory accuracy versus 0.492 reasoning, a gap of 0.286. The encoder-only architecture show an even larger gap, 0.822 memory versus 0.479 reasoning, a difference of 0.344. Critically, this bias holds across both attention G directionalities, which points to pre-training objective as the root cause rather than architectural constraints. Most models are pre-training on tasks that emphasize factual recall over multiple step reasoning, and that specialization persists through a fine-tuning. Only 3 models out of 19 favor reasoning over memory. Confirm this is a systematic pattern, but cognitive specialization is only one dimension. We also need to consider prediction stability. And when we consider the stability and accuracy and stability are orthogonal, as I said before. And this is in this slide illustrated the 4 possible combinations: high accuracy, low variance; high accuracy, high variance; low accuracy, low variance; low accuracy and high variance. This is a robustness deployment. That's I would say that these findings have a direct practical implication, and when you see how robust those modules is and how you implement it, you cannot really chase accuracy and benchmarks. When you look at practical implications, they translate these findings into actionable guidance. Like the big things is we try to make this as a guidance when you choose a model, when you train a model. First, architecture matter more than a scale. Robustness is accuracy dependent. We found no reliable correlation between model size and stability.
Excuse me, sir.
Yes.
Just a quick reminder, you have 2 more minutes of presentation time left.
Okay, got you. And the second, if you single generate proposed recommendation certainty application, the beta is small, then 75% of handles drop out, graceful to low variance. And our contribution this is what we think we can contribute here. We have a broad benchmark, we have a cognitive split, and we have robustness factors and methodology. In closing, we have 3 takeaways. Inference methodology matter is much more than architecture in Monte Carlo dropout. It's over universal 53% of models, and these specialized models lose about 25% of points. Now I'm open for a question, and if you guys have any questions, I'm here to answer.
Thank you for your presentation, sir. I now ask our session chair for any questions.
Doctor, your work is really impressive. I just want to ask you a very basic question. Whatever the paper you have used as a base paper and whatever your work you're showing here, what you can say, what is the difference between it? At what margin you can say your base paper is somewhat differ from that base paper?
Yeah, it's mentioned in the paper, and I try to get your question here to answer, give you a better answer. But I mentioned in the paper that the papers that was using before, the stories that was using before, and on the 12 minutes presentation, it's very hard to talk about the papers. But I mentioned on the paper, and I would strongly advise you to go and read the paper to understand them. But all these stories that was done before, they did not have the same broad view that we did on this story, and try to make we are trying to make like a Monte Carlo dropout that is not automatic correct. Like basically, like we try to say if you use this, is not automatically the correct way to choose a model, to train a model. And the difference between the model size really not really matter, because we have seen a bigger, larger model that's really good, but we also have seen larger model that's not that good.
Okay.
And I think the big thing is actually what really defines is the encoding and decoding models. Like the dropout acts differently in encoding and decoding. I think is the big thing is because you have resource, you have memory, and you have reason. One thing is more logical, and one thing is more hardware. One thing is rely more in logic, and one thing is rely more in hardware resource. And that, but I really strong view to like go the paper, look the paper is way better answering the paper than answer you here right now.
Well, thank you for your answer, sir. That was a great presentation. We now move on to our next presentation for this session. So our next presenter is Nurul Ayu Najwa binti Muhammad Zubair. I am really sorry for any mispronunciations, but she belongs to the University of Technology in Malaysia. And the title of the research paper is Pilot Validation of a Home-Based Oral Habilitation Questionnaire Towards Teleaudiology-Enabled Family-Centered Care. Ma'am, I request you to kindly unmute yourself and start presenting.
Hello, can you guys hear me?
Yes, ma'am, you are audible.
Okay, just a moment, I need to share my
Sure.
slide. Okay, can you see my slide?
Yes, your screen is visible and you are audible as well, so you can start.
Okay, good morning, good afternoon, good evening, and good day. I bid to everyone. My name is Ayu I am a postgraduate student from University of Technology Malaysia. So today I will present our paper, which is Pilot Validation of a Home-Based Oral Rehabilitation Questionnaire towards Teleaudiology-Enabled Family-Centered Care. Okay, the background of this study, childhood hearing loss is a significant global health issue. Children with hearing impairment often experience delays in language and communication development, which can affect their academic performance. Importantly, this challenge don't just stop in childhood. They often extend into adulthood, impacting their social participation and also overall quality of life. So, because of this, early and consistent intervention is critical to support the optimal development of these hearing impaired children. So, one approach or one kind of intervention that has gained attention is home based oral rehabilitation, or short form HPAH. So, this kind of intervention actually complements clinic based services by embedding intervention activities into daily home routines. For this type of intervention, parents play a central role because they need to support their children listening, communication, and device use outside the clinic, which is at their home. So, with advancement in teleaudiology, professional support can now be delivered remotely, reducing the need for frequent in person visits while still supporting families at home. But the problem is in Malaysian context, despite the importance and also the attention of HPAH, in Malaysia there is a limited empirical data on caregivers' experience with home-based oral rehabilitations. So, more importantly, there is currently no locally validated tool that systematically assess caregiver barriers, readiness, facilitators, and experience in teleaudiology. So this gap is becoming more relevant as remote audiology services are increasingly used in routine care. So the aim of this study is to address this gap. This study is aimed to pilot validate the home-based oral rehabilitation barriers, readiness and facilitators, short form HBRF, that is developed by us. So specifically, the objective were to examine the content validity, internal consistency, reliability, and also the preliminary factor structure using EFA, or exploratory factor analysis. So for the methodology, this was a quantitative cross-sectional pilot study involving 30 caregivers of children with hearing impairment. Ethical approval was obtained through the National Medical Research Register, and the data were collected using an online questionnaire, which is the HBRF questionnaire that we developed. So this questionnaire covers 5 domains, which is barrier, readiness, facilitators, teleaudiology, and also satisfaction with audiology services. So the instrument was adapted from established tools such as speech and also the Family Needs Survey, the FNS. And it also went forward backward translation to produce Malay and English versions because we are in Malaysia, so the parents prefer to answer the questionnaire more in Malay. So for the validation process followed three key steps. First, content validity was assessed through expert review using the Content Validity Index, the CVI. Second, internal consistency reliability was examined using Chromebase Alpha for each subscale. And finally, the AFA was conducted to explore the preliminary factor structure using principal axis factoring and also oblique rotation. So the Chromebase Alpha and AFA the analysis was conducted using SPSS. So the result is for the content validity, five experts in audiology and rehabilitation, which include speech therapies and also the head of audiologists in Malaysia. They evaluate the questionnaire items and they give the mean ICVI 0.97 and the scale level CVI was 0.9. So this indicate that the content validity is very excellent, and based on expert qualitative feedback, minor wording refinement were made and one additional teleaudiology related item was added to strengthen the content coverage. For the reliability, the internal consistency reliability across the questionnaire was strong with Chromebase alpha values ranging from 0.77 to 0.96. So this indicates good to excellent reliability across domains, suggesting consistent caregiver response and coherent measurement of the intended constructs. For the EFA, most subskills demonstrate clear single-factor structures supporting their conceptual alignment, but there are some multicollinearity observed within the barrier domains with suggesting overlap between closely related items. So in the teleology domain, factor extraction was unsuccessful for the access and perception subscales, likely due to the high inter-item correlation and the small pilot sample size. This is actually a very common issue in the early stage validation studies. So this is the script plot. The sharp drop after the first factor support the decision to retain a single dominant factor. So similar patterns were observed across other stable subscales. So after we get the result, rather than removing items, identified issues were addressed through targeted refinements. For example, wording adjustments were made for items that shows multicollinearity, and also one facilitated item was removed to improve reliability. And for the teleaudiology section, it will refine with one new item added. So the implication of this study, why this study matters, it actually helped audiologists identify caregiver readiness gaps and specific support needs. The result can inform caregiver training, follow-up strategies, and decision around the use of teleaudiology and also remote support. So for this study, we also have some limitations, including the small pilot sample size and reliance on online self-report data, which may introduce response bias. Teleology response may also have been influenced by caregiver familiarity with digital tools. So, future studies with larger samples are needed to conduct CFA and further refine the teleaudiology subscales. So, in conclusion, the questionnaire we developed demonstrates strong preliminary psychometric performance and provide a structured, culturally relevant tool for understanding caregiver engagement in home-based oral rehabilitation. It also supports the integration of teleaudiology and other digital approach within family-centered audiological care. That's all from me. Thank you.
Thank you so much for your presentation, ma'am. I now ask our session chair if he has any questions for you.
Hello.
Hello.
It's really good that you took or you choose the society related problem and the solution for it. I just want to ask you only one question. Which tools you have been used for the results?
Sorry.
Which tools you have used for results, your result, whatever the result you got, you receive, which tools you have been used?
Uh, So for this study, we use SPSS to analyze our reliability and also FA.
Okay.
And for the CBI, it was based on expert ratings. We actually have 5 experts that evaluate this questionnaire. The experts consist of speech therapies and also the head of audiologists in Malaysia.
Okay.
Thank you so much for your presentation, ma'am.
Thank you.
We now move on to our next presenter. So our next presenter for this session is PGDD Ranavansha from the Sri Lankan Institute of Information Technology. And the title of the research paper is SMOTE-based class balancing and feature scaling for enhanced coronary heart disease risk prediction using machine learning. So I request you to kindly unmute yourself and start presenting.
So, am I audible?
Yes, sir, you are audible.
Okay, thank you. So, let me first share my screen. I hope you can see my screen.
Yes, your screen is visible and you are audible as well, so you can start.
Okay, thank you. So, good afternoon and good evening for everyone. So, today I'm going to present our research, which title is Mode-based class balancing and feature scaling for enhanced coronary heart disease risk prediction. So, our study investigates how pre-processing, especially feature scaling techniques, interacts with SMOT, synthetic minority oversampling technique in long-term cardiovascular disease risk prediction. So, as an introduction, cardiovascular diseases are one of the leading global cause of death. So, according to WHO, 17.9 million deaths were recorded in 2019, and it will be 30 million deaths by 2040. So, among the cardiovascular diseases, coronary heart diseases are the most common subtype. So, and the traditional diagnostic methods such as the ECG, MRI, they are advanced in tech and costly and inaccessible by the low privileges communities. So it creates an opportunity for the machine learning based decision support system that can create affordable and something like early risk prediction system. So as you can see in this slide, so machine learning models based on the supervised learning based on the dataset. So healthcare datasets often suffer from severe class imbalance in their target variable. So unless if we solve this problem, our models will be biased into the majority class. So that's why we have to use the synthetic minority oversampling technique. And our pre-processing choices will be very effective on those SMOT. So need for a reliable 10-year coronary heart disease risk prediction, we have to very careful about our pre-processing and balancing about those dataset things. So here our research objectives. So we are evaluating the impact of feature scaling with the SMOT on various machine learning models, and we compare the different scaling types like min-max scaling and standardization in separate pre-processing pipelines. And we analyze the performance across various machine learning models. And let's see what's the clinically reliable pre-processing strategies with reason. So for our model building, we have choose the Framingham Heart Study dataset, which is and very reputed and a dataset with a long history about long-term prediction. So that dataset originally consists of 4,240 records. It has 15 independent features and one dependent features, which is the 10-year coronary heart disease risk. So our dataset suffers from the severe class imbalance. It has only 15.2% from the target feature, which shows the positive for the 10-year heart disease risk. So when it comes to the dataset, here you can see several categorical features and also numerical features are suffering from the missing values. So first we have to start from there. We have to solve all of these things. So the methodology of our research have consists of three major phases. So the phase 1, which is about data pre-processing and feature engineering. Phase 2 is the model training with SMART. Phase 3 is the model evaluation using different performance matrices. So as you can see in this diagram, here the original version of our dataset, it has 16 total features and 4,240 records. Then we go through a pre-processing pipeline, missing value handling, outlier handling, feature engineering, encoding, SMART. Then we have a balanced dataset, which consists of 7,192 records. So after that, we use two different kind of scaling methods. We use min-max scaling and standardization and create two different pre-processed dataset. So in the phase 2, those two different pre-processed dataset are going through 5 different supervised learning models. Then from each of these, model A will be trained on the min-max scale dataset, and the model B will train on the standardized dataset. So here we have as the supervised machine learning model, random forest, support vector machine, k-nearest neighbor, decision tree, and logistic regression. So after model training, we evaluate them using the accuracy, precision, recall, F1 score, ROC, AUC curve. So sorry for the inconvenience. So first in the pre-processing stage, we handle the missing value using mean, median, and mode imputation based on the outliers and the feature type. Then we handle outliers by using the IQR-based winsorization. Then we encoded the categorical features using one-hot encoding, like education. Then we solve the class imbalance problem using SMART. Then here you can see we have generated 2 new features by feature engineering, like pulse pressure and cholesterol to age ratio. Then we evaluate those two kind of min-max scaling and standardization. Here we have our 5 machine learning models and the performance matrices. So this is the result what we got. So as you can see here, we have the 5 different kind of supervised learning models, and each one with the model A, which means the min-max scaling and min-max scale dataset, model B, standardized dataset. So as you can see the evaluation, random forests have achieved the best performance by achieving the accuracy more than 90% in both the scaling models. And especially in healthcare machine learning models, recall plays an important role. So after that, here we have the KNN, which also shows a huge amount of improvement in the recall in standardized preprocessed dataset. So when you look at all of these things, these performance, we can say as an overall performance, standardization shows the best thing more than min-max scaling. So when we look at again the random forest, you can see it showed the improved recall in the standardized dataset more than the min-max scale dataset. As a percentage, it will be 0.28%, which means 28 additional high-risk individual detected per 10,000 patient population. So in clinical context, that difference is meaningful. Here you can see the ROC AUC performance of the models of the random forest, which shows the best thing. So there's a marginal difference between those two.
Excuse me, sir.
Okay.
Just a small reminder, you have 2 minutes of presentation time left.
Okay. Okay. Thank
Thank
you. Here, the standardization slightly improved the recall, and distance-based models like the KNN, it benefited the most from the standardization. So as key findings, so scaling impact depends on the algorithm type. So tree-based models are scale invariant, and standardization reduces the false negatives. And it gives the improved clinical reliability. And as a conclusion, first we start from the problem of the real-world healthcare dataset. So they are naturally class imbalance, and we have to use the SMOT. So SMOT plus the proper scaling methods gives us the best result, and that's why we should be careful about that. So, and also standardization, it is preferred in recall critical healthcare systems like cardiovascular diseases. So as I mentioned, the Framingham dataset, which is a US-based dataset, and in our future work, we are planning to build a proper long-term dataset for the South Asian population, and we plan to develop this system with explainable AI and statistical validation across cross-validation. And thank you for your attention, and we are open for the questions.
Thank you so much for your presentation, sir. I now request our session chair if he has any questions for you.
You have presented good work, no doubt. Heart disease is a real issue we are facing nowadays. And you have compared all the or various algorithms on the basis of different parameters such as EUC, accuracy, precision, F1 score, and all. I just want to ask you, have you discussed these results with any heart specialist, doctor?
Not yet, sir, because there's a problem about the population of the dataset. There's a population bias in our dataset, which is a US-based one, and we are here in a South Asian population. So, but we discussed about developing a dataset in this context in South Asian region.
Okay, as it's a clinical contest, na? So it's just an advice to you. Please discuss with the heart specialist so that you will get more and more inputs from him, and you can implement those things. Thank you.
Okay, sir. Thank you.
Thank you so much for your presentation, sir. We can now move on to our next presenter for today's session. So our next presenter is Saeed Al-Dosari from the Prince Satam bin Abdulaziz University in Saudi Arabia. And the title of his research paper is Statistical Analysis and Machine Learning Approach for Detecting Malicious DNS over HTTPS Traffic. Sir, I request you to kindly unmute yourself and start presenting.
Hi everyone. Now I would like to share my presentation. Can you hear my voice and see my presentation?
Yes, your presentation is visible and you are audible as well. You can start.
Okay, a good day for everyone. This research investigates the detection of malicious DNS over HTTPS traffic using statistical flow, level features, and machine learning models. The focus is on encrypted environments where payload inspection is unavailable. Traditionally, DNS operated over UDP without encryption, which has exposed user queries to surveillance and manipulation. DNS over HTTPS was introduced to improve privacy by encrypting DNS queries inside HTTPS traffic. However, while encryption enhances confidentiality, it also enables attackers to hide malicious tunneling within legitimate encrypted flows. This creates a visibility challenge for intrusion detection systems, IDS. This leads us directly to the core problem. The primary issue is payload obscurity. Since DOH traffic is encrypted, bucket level inspection is no longer possible. In addition, the dataset presents severe class imbalance, where malicious flow dominates. Furthermore, most current detection systems rely on two-tier architecture, complicating evaluation and isolating classifier behavior. These limitations reveal a gap in a current research. Most peer studies use two-stage pipeline. First, detecting DOH traffic, then classifying malicious flow. However, the second layer is rarely evaluated independently. Additionally, many studies compare models under inconsistent pre-processing conditions. This limits objective performance comparison. To address these gaps, we propose the following contributions. First, we propose a simplified single-layer detection architecture focusing only on malicious DOH classification. Second, we rely exclusively on flow-level statistical feature without payload inspection. Third, we conduct a unified evaluation of four machine learning models under identical conditions. Finally, we evaluate performance under strict encryption constraints. For our dataset, we use the Syria CIS DOH browser 2020 dataset, which contains DOH traffic generated from multiple browsers and tunneling tools. The dataset is highly imbalanced, with approximately about 92.65% malicious flows. This imbalance reflects a realistic but challenging operational condition. Based on this dataset, we designed a simplified detection architecture. Instead of using two-layer system, we focus exclusively on the second layer. When DOH traffic is identified, the model directly classifies flow as a benign or malicious using statistical features only. This approach isolates classifier behavior under encrypted conditions. The task is binary classification between benign and malicious DOH flows. The dataset was divided into training, validation, and test subsets. All models underwent identical pre-processing steps to ensure fairness. Evaluation metrics included accuracy, precision, recall, and F1 score. And no payload inspection was used at any stages. To enhance discrimination, we performed statistical feature engineering. Timestamp decomposition enabled extraction of temporal pattern. Time of day grouping captured behavioral variations. Flow types difference was introduced to detect bidirectional asymmetry. Transmission and recapture rates were also incorporated. Temporal features improved minority class recall, particularly for tree-based models. 4 classifiers were evaluated: random forest and gradient boosting as a ensemble tree-based model, support vector machine with RBF kernel, and fully connected artificial neural network. All models were trained and evaluated under identical conditions. Now we will see the results before feature engineering. Before feature engineering, gradient boosting already achieved perfect performance, and artificial neural network achieved near perfect results. Random forest performed strongly, and support vector machine showed reduced recall due to imbalance sensitivity. After feature engineering, after incorporating temporal features, now random forest showed noticeable improvement in minority recall. Gradient boosting maintained perfect performance. Artificial neural network remained highly stable, and support vector machine showed only marginal improvement. Although perfect accuracy was observed for some models, results must be interpreted carefully, and independent validation and test sets were used. However, cross-dataset validation was not performed. Therefore, performance may reflect dataset-specific characteristics. The confusion matrix provide detailed classification behavior. Gradient boosting achieves 0 misclassification. Artificial neural network misclassified only a minimal number of benign samples. A random forest improved minority recall after feature engineering. Support vector machine exhibited poor benign recall due to imbalance sensitivity. Encryption doesn't imply undetectability. Flow level statistical feature remain highly discriminative. A tree-based boosting and artificial network perform-based. Support vector machine showed high sensitivity of imbalance. limitation and constraints. The study realized on a single dataset. No cross-dataset validation was conducted. Real-time deployment testing has not yet been performed. Dataset-specific bias remains a possible limitation. For future work, includes a cross-dataset evaluation, cost-sensitive learning for imbalance mitigation, integration for explainable AI methods, and evaluation under operational deployment scenarios. Thank you for listening.
Thank you so much for your presentation, sir. I would now like to ask our session chair if he has any questions for you.
Said, good work. In future, we would like to see whatever the limitations you have received in your research work, that is cross-validation and real-time deployment. So we would like to see in future. Thank you.
Okay, thanks.
Yes.
Thank you so much for your presentation, sir. We now move on to the last presentation for this particular session, which will be done by Vangelis Malamas. I apologize for any mispronunciations. He is from the Hellenic Open University in Greece, and the title of the research paper is Synthetic Knowledge in Intelligent Systems, Life Cycle Models, Information Quality Degradation, and Trust-Aware Design. Sir, I request you to kindly unmute yourself and start presenting.
I have unmuted myself. Okay, so let me. Let me. 1 second, please.
Sure, sir. Take your time.
I have to reconnect.
Are you facing any issues, sir?
Yeah, I need to give rights to share my screen, so I will reconnect again. Give me 1 second.
Sure, sir.
Can you see my screen?
Yes, sir. Your screen is visible and you are audible as well. You can start presenting.
Okay. Good afternoon. I'm Vangelis Malamas, and today I will present our work about synthetic knowledge in intelligent system. First of all, I have to say this is a joint work with my other colleagues, and I will explain in this paper, we explain why generative AI does not simply produce information, but produces a distinct class of epistemic artifacts that we call synthetic knowledge. And we will explain why this matters for information quality, trust, and governance in intelligent systems. So, to set the context, generative AI systems are now embedded across enterprise platform, decision support systems, CRM tools, and even policy support application. What is new is that these systems do not just analyze or retrieve information. They actively generate textual and symbolic artifacts that people and organizations increasingly treat as knowledge inputs. So the shift is structural. We move from classic information systems that mainly support automation and analytics towards systems that continuously produce knowledge like artifacts at scale. And our key point is if we treat these outputs as ordinary information artifacts, we miss an important system level transformation. So here is the hidden assumption we challenge. In much of information system research and practice, AI outputs are treated as conventional information artifacts. In other words, they are handled as if they are comparable to human-generated knowledge, or that they are stable, traceable, and verifiable. So they are integrated into decision workflows and organizational repositories without epistemic differentiation. But Gen AI outputs are not produced the same way. They are not grounded in a traceable chains of evidence by default, and that creates a gap between how they look and what they actually are. So let me make the problem explicit. Uh, Generative AI outputs are probabilistic. They are often weakly grounded, and their generative logic is opaque. This means an output can look coherent and authoritative, but still be partially incorrect, ungrounded, or unverifiable. So the problem is not only hallucinations, which is commonly discussed in research as isolated model failures. The real risk is what happens when these outputs are reused, institutionalized, and recursively propagated across systems, because then they start to function as an organizational knowledge base. That is why we argue this is a system level epistemic problem and not just a model level accuracy issue. Now, there is already a lot of work on generative AI for ethics, transparency, bias, and regulation, which are heavily discussed. But what is missing is a coherent system level account of how AI generated knowledge reshapes information quality, trust calibration, and governance when it's embedded into social technical system. Specifically, we do not yet have a lifecycle based epistemic model, a system level trust calibration framework, nor a construct that capture recursive reuse and propagation. So our objective through this paper is to introduce synthetic knowledge as a distinct epistemic category and then build life cycle and trust calibration models around it. To do this, we synthesize four established conceptual streams. First, information quality theory, which traditionally evaluates accuracy, completeness, credibility, consistency, and other similar dimensions. Second, the knowledge-based view of the firm, where knowledge is treated as a strategic organizational asset. Third, the decision support systems and automation bias, which explains how automated recommendation shape human judgment and reliance. And fourth, the information system governance, which focuses on accountability, auditability, and decision rights. We integrate these streams through a unified epistemic lens, and so why Gen AI outputs require a distinct analytical treatment as synthetic knowledge. Here we explain why classical information quality assumptions break. LLMs generate output probabilistically. Formally, the output is generated token by token, conditioned on the context, by sampling from a learned probability distribution. The key implication is that correctness becomes probabilistic rather than deterministic. An output may be linguistically fluent, coherent, and contextually appropriate, but not necessarily factually grounded. So fluency is not evidence. In fact, it can obscure uncertainty. That's why we say truth conditions become latent, and the epistemic reliability of the output is not directly observable from the surface form. We express this generation formally with this equation, which highlights that the system is sampling sequences under uncertainty. So these slides capture a central distinction, perceived quality versus epistemic quality. We define perceived information quality as a function of surface level signals, for example, coherence, linguistic fluency, and the user's perception of uncertainty. So in practice, users often evaluate quality based on how readable, confident, and well-structured the output seems. But epistemic reliability depends on grounding and validation, things that are not visible from the surface. So the key risk in systemic divergence perceived quality can consistently overestimate epistemic reliability, thus creating a risk region where confidence-looking content is trusted beyond what is justified. Now we connect this to trust. In decision support research, we know automation bias is common. Users over-rely on automated outputs even when other evidence contradicts them. Synthetic knowledge amplifies this because it combines probabilistic inference with high fluency and contextual adaptability. So people interpret the output as an authoritative knowledge claim rather than a contingent recommendation. In our paper, we express trust calibration error as the gap between user trust and actual system reliability. And we see that when synthetic knowledge increases perceived competence without equivalent improvement in epistemic robustness, we get overtrust. And overtrust leads to reduced contestability, fewer challenges, less verification, and weaker human oversight. So, for next is the governance consequence, epistemic accountability. In traditional governance, accountability assumes we can trace decisions back to sources, authorship, and validation processes. But with Gen AI, outputs are emergent properties of high-dimensional parameter spaces. This makes provenance partial or absent, and it becomes difficult to contest individual knowledge claims. So we conceptualize epistemic accountability as depending on three factors: provenance, visibility, validation mechanisms, and human oversight. In other words, if we cannot see where the content came from, cannot validate it, and do not maintain effective oversight, then accountability collapse. And that becomes a system level governance problem and not simply a user training issue. So our central construct, we define synthetic knowledge as epistemic artifact generated by probabilistic AI systems that are weakly grounded in verifiable sources, opaque in the generative logic, and capable of recursive reuse across socio-technical systems. This is not simple data or information. It presents itself as a knowledge claim without a stable, directly inspectable epistemic lineage. In our work, we formalize a synthetic knowledge artifact as a tuple of observable output, generative process, provenance trace, and contextual condition.
Excuse me, sir.
Yeah,
I'm sorry to interrupt, but you have 2 more minutes of presentation time left.
Yeah, thank you. And the important asymmetry in this is that users see the output, but the generative process and provenance are largely hidden. So, finally, we propose a life cycle model to explain how synthetic knowledge becomes a systemic risk. On stage one is the generation. The artifact is produced through probabilistic inference, and uncertainty is highest, but often least visible because the output is fluent. In stage two is reuse. The artifact is inserted into reports, documentation, decision workflows, often without explicit validation. In stage three, it's the amplification. The repeated reuse increases perceived legitimacy. Over time, the artifact begins to be treated as institutional knowledge. And in stage four is contamination. Unvalidated or partially incorrected artifacts drift into the organizational knowledge base and can be re-ingested into new AI systems or downstream decision processes. So the key message is epistemic fragility scales through repeated reuse, even without a single model failure. Finally, to conclude, our contribution is we're trying to reposition Gen AI not just as a productivity tool, but as a sustained producer of synthetic knowledge, an epistemic artifact class with distinct properties and life cycle risks. And this matters because it affects information quality, trust calibration, and governance in intelligence system, especially where decisions are high stakes. I tried to be as fast as I could. But thank you for your attention, and I will be happy to answer any of your questions.
Thank you so much for your presentation, sir. I now request our session chair if he has any questions for you.
Good work, author, and a nice use of LLM. So thank you.
Well, thank you so much for your presentation, sir. And with that, we conclude this technical session. I now request our session chair, Dr. Sagar Bhilaji Shinde, I apologize, to give us his closing remarks.
A nice experience, whatever the researcher have been participated from the various countries, and whatever the inputs regarding the research, whatever their research work, whatever the objective define, and it's in different area. So it's benefited to all of us to know the current research in their country and whatever the future scope is available for the new researcher to do the work in the same domain. So nice presentation and congratulate to all of you for the participation. And one most important thing that Mr. Amog, who is a BTech student in the affiliated to Savitribai Phule Pune University, and whatever the event is organized, it's in well manner and he's a completely focused, and it's really good that he has been completed the event in a stipulated time period, and his concentration is good in all the research work, and no doubt whatever the gain, whatever the things that have been observed by Amok, and he will nicely form the new objective from this current research. And all the best to all the participant and Amok for the future work.
Thank you so much for your kind words, sir. Well, I now sincerely thank all of our authors for their excellent presentations and contributions towards this session, and all of our participants for being a part of this international conference. I hope this session was informative enough for all of us. And on behalf of the entire team of ICICT, I thank every one of you for showing your support for this 11th version of the conference. And we will be more than happy to host all of you in the 12th version, which will happen in 2027 as well. A quick announcement for all the presenters. You will be getting your digital certificates via email within 2 working days. And also, the publications will be live within 7 to 8 months. So please coordinate with the ICICT team. And I also thank our session chair once again for chairing this session. This is just a small token of appreciation on behalf of Team ICICT. So thank you so much for your valuable presence. I now request all of you to switch on your cameras for a quick snapshot of this virtual conference. And we are done. Thank you so much, everyone, for attending this session. Stay safe and take care.
Thank you. Bye-bye.
Bye-bye.